I'd like to call upon Dr. Nadu, Senior Consultant, Surgical Oncology, Apollo Cancer Centre, Vanagaram, to facilitate Dr. Kalai Chelvi K, President, Tamil Nadu Medical and Pediatric Oncology Society. Now can I have Dr. Gautaman, HOD and Senior Consultant, Surgical Oncology, Apollo Cancer Centre, Vanagaram, to facilitate Dr. Ayappan, Secretary, Tamil Nadu Association of Surgical Oncology. Now we move on to an insightful panel discussion of the importance of making cancer a notifiable disease. We have with us a panel of distinguished experts who will share their...
Namaste and good afternoon. Dr. Balasundaram V, President Association of Radiation Oncologists of India, Tamil Nadu and Puducherry Chapter. Dr. Kalai Chelvi K, President Tamil Nadu Medical and Pediatric Oncology Society, TAMPOS. Dr. Ayappan, my dear friend, Secretary, TN Association of Surgical Oncology. Dr. Sankar Srinivasan, Dr. Prasad Eswaran, Dr. Suresh, and our other eminent oncologists from our beloved Apollo family, respected members from the media and guests. A very good afternoon, everybody. It is my distinct privilege to welcome all of you to our United to Notify press conference on this extremely important World Cancer Day. Today, we gather under a common purpose, which is to rally support for making cancer a notifiable disease across India. This single measure, compelling though it may sound, has the potential to dramatically enhance how we detect, record, and ultimately treat this pervasive illness. At the Apollo hospitals, our relentless pursuit has always been to transform the way healthcare is delivered. Recognizing cancer as a notifiable disease on a national level is more than just a legal classification. It is a clarion call to ensure every case, every patient, and every data point is accurately accounted for. Tamil Nadu has already taken this bold step by designating cancer as a notifiable disease. And their exemplary model shows us that better data tracking leads to more precise treatment protocols, more reliable statistics, and the development of region-specific interventions. By taking inspiration from Tamil Nadu's forward-thinking stance, the entire nation can adopt a standardized framework that not only improves patient outcomes, but also shapes future research and policy decisions. We are just moments away to witness a truly enlightening panel discussion featuring an eminent group of experts from the oncology field in Tamil Nadu. The World Health Organization projects that the incidence of cancer in India will only continue to grow if significant steps are not taken very soon. We believe that a nationwide notifiable status for cancer will establish real-time data capture to help us better understand cancer trends, enabling more accurate allocation of resources and expertise. It will drive the creation of unified treatment protocols, ensuring consistency in care regardless of geography or socio-economic factors. It will also support more targeted research and innovation, allowing for personalized medicine and improved outcomes in both common and rare cancers. Achieving these objectives will require the collective willpower of our policymakers, healthcare providers, medical associations, patient advocacy groups, and the media. Each one of us play a crucial role in this journey. By raising our voices together, we can empower the Government of India to fast-track legislation that designates cancer as a notifiable disease. This is not merely about fulfilling a procedural requirement. It is about giving patients the most precious gift of all, which is hope. Let us leave here emboldened by the knowledge that we possess, a workable plan, and the commitment of our experts across disciplines. We have an incredible opportunity to leave a lasting mark on the future of oncology in India, one in which no cancer goes unreported, no community is overlooked, and no patient fights this battle alone. Thank you all for your unwavering support and for joining us in this collective endeavor. Together, let us ensure that every cancer case counts, every patient's journey is documented, and every effort converges on the mission to win over cancer. Thank you.
You have to do something. How do you view this?
Thank you for the opportunity. Good morning, everybody. See, it's a very important thing that we are having this discussion, because notification is going to be very important. In the sense, see, surgeons, what happens is it's all the treatment modalities are evolution based. So over a period of time, we evolve in all the surgical techniques. So by notifying, what we actually see is in some areas, some surgical procedures may be followed. So if surgery, what is surgery? Surgery is there's a tumor there, we try and clear off that by giving a resection. Some margins are usually given. This is a very small example I'm giving. So margins are given. So if we have a data saying that this, for this particular type of a tumor, this amount of margin is going to be adequate. So it becomes a standardization, and the results following that particular treatment. So what is going to be the survival of the patient? What is the outcome of the patient? What are the complications of the patient? So if these things are going to be, a notification is not just a notification, it's a real-time thing. Whatever is happening for the patient needs to be informed. So that is what is going to be beneficial for the rest of the surgical community. If you're going to take me, for example, in some area, one particular type of cancer is very common and they follow some type of procedure and they get good results out of it, and that is going to be given to the center. And from that, we learn. Likewise, modern modality. For a classical example, what is happening now? Now, in the rectal cancer, if there is going to be low rectal cancer, everybody is scared about a colostomy. So we in our center, in Apollo, we are following something called the wait and watch policy, where we try to avoid a surgical modality. So this is being given to the notification. We have already passed on this information. Where if some other surgeon is going to read this and they come to know about it, they will be able to follow this technique, whereby you can avoid a stoma for a patient, because patients are really scared about a stoma. They don't want, because the social life is going to be affected. So this sort of information is going to be sent. That's one thing. And from the government point of view, as Sir was rightly pointing out, a particular geographical area, if they have one particular type of cancer, so that the screening can be done. So you can go in for prevention methods. You can allocate more funds. That way, I think it's going to be really beneficial if the whole thing is going to be and cancer is going to be made. So some people might ask, why should it be a notifiable disease? So it's not like a cholera or something where you immediately notify. No, we have a severity in this disease. It's a life-threatening disease. Why all the other things are being notified? Because it's a life-threatening thing. Here, it's definitely a life-threatening thing. So that needs to be notified. So that uniform type of a treatment is received, it's given to almost without categorizing you are rich, you are poor, you are living in that area. So that facility can go if the disease is notified.
Thanks, Dr. Kalai Chelvi, being a medical oncologist and the president of the TAMPOS. Medical oncology is an upcoming field in India, and in the last 15-20 years, things have changed so much with the way the patients are getting treated, how it was like when we were in training and how it is now. How do you think the notifiable disease concept and allocation of resources and everything will help in our field?
Thanks for the opportunity. Making cancer as a notifiable disease has been, we've been through it for the last almost 30 years. I remember Dr. Shanta from Cancer Institute used to, every time she used to plead the government, and finally she got it. And that's how the Tamil Nadu Cancer Registry was started, and we have valuable data available from Tamil Nadu. And in fact, the world data, statistics data, they used to criticize that India gets data only from the metropolitan registries, and it is not a population-based data. And after starting this become a notifiable disease cancer, so we get most reliable data from each state, and almost 12 states are having a